Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. Welcome back, everybody. You're listening to Policy and Rights here on Depictions Media Radio. I am Michael Clogs, your host today. These are updates for May 17th, which was on Monday. So some really big things are the World Health Organization was pleased to announce a reduction in new cases of COVID-19, but there's still that message out there that we need to do better at getting vaccinations to lower income countries. We need to do more to get those protections and the medical equipment needed to those countries that have fewer resources from those countries that have great resources available to them. India is still a hotspot. Brazil is still a hotspot, and there's other hotspots still in South America that need to be closely guarded and looked after. On the, of course, the Canada front and of course for BC, yes, there are fewer cases being reported, but there are still hospitalizations happening, and people are and resources are still being stretched. So the message from the BC Public Health Officer, Dr. Bonnie Henry, is, of course, hey, get registered for your vaccine and get your dose to help protect the community on the whole. Okay, so along with that, the President of the United States, Joe Biden, he is talking about things that have been working well for the U.S. Vaccination program. And he's discussing the number of vaccines that have gotten out there. And they're also introducing a incentive program that looks similar to, hey, have a coupon for so much off your grocery bill because you got your vaccine here done at our site. So the vaccination programs are moving along, even with a hiccup from the guard change for the trafficking of vaccine across Canada due to a investigation done into one of the major generals in charge of the vaccination program. The Canada vaccine program is moving along. People are getting their vaccines. They are getting their shots in their arms. So, Prime Minister Justin Trudeau will talk a little bit about that, along with one of the ministers on his team. But one of the big things that he's going to announce that you're going to hear about is they're looking to launch a energy auditor program, and this going along with they want Canadian homes to become more energy efficient. So this auditor program that they're looking, the energy auditor program is looking to go inside with refitting homes so that they are more energy efficient, and thus with the more being energy efficient, they're becoming more carbon friendly. It's part of the whole program of Canada trying to achieve a net zero carbon footprint. So let's start off our program today, and we're going to listen first to Dr. Tedros and his team talk about what's happening in our world with the pandemic. Thank you for listening to Depictions Media Radio.
Thank you, Christian. Good morning, good afternoon, and good evening. For the second week in a row, there has been a global decline in cases and deaths from COVID-19. There is a huge disconnect growing where in some countries with the highest vaccination rates, there appears to be a mindset that the pandemic is over, while others are experiencing huge waves of infection. The situation in a number of countries continues to be very concerning. The pandemic is a long way far from over, and it will not be over anywhere until it's over everywhere. Even some places that have previously done very well at containing COVID-19 are seeing dramatic increases in cases, hospitalizations, and deaths. New variants of concern, fragile health systems, reduced implementation of public health measures, and supply shortages of oxygen, dexamethasone, and vaccines are all compounding the current situation. But there are solutions to these problems. Where cases are rising, now is the moment to ensure people are adhering to public health measures, including physical distancing, the wearing of masks, and preventing large gatherings. Even where cases have dropped, genetic sequencing is critical so that variants can be tracked and measures are not eased prematurely. WHO has been responding to the surge in cases in India and other hotspots. However, demand is currently so high that WHO needs immediate funding in order to sustain its technical and operational support to all countries, especially the most affected, involved in the present wave. In 2020, donors very generously contributed to the Strategic Preparedness and Response Plan. However, in 2021, the current response plan is underfunded, and the vast majority of that is ring-fenced by donors for specific countries or activities. This is constraining WHO's ability to provide an adaptable and scalable response in emerging hotspots. WHO requires urgent funding to the current response plan, which would allow us to scale up support for countries and support the ACT Accelerator. Flexibility of that finance is key, not just so that we can respond quickly to the emergency needs in several countries, including Nepal, but that we can work to save lives and livelihoods where it's most needed in a rapidly evolving situation. On vaccine supply, I want to reiterate the statement that was released by UNICEF overnight, which outlines the huge shortfall in vaccine supply to COVAX. The surge in cases has compromised global vaccine supply, and there is already a shortfall of 190 million doses to COVAX by the end of June. COVAX works and has so far delivered 65 million doses to 124 countries and economies, but it is dependent on countries and manufacturers honoring their commitment. While we appreciate the work of AstraZeneca, who have been steadily increasing the speed and volume of their deliveries, we need other manufacturers to follow suit. Pfizer has committed to providing 40 million doses of vaccines with COVAX this year, but the majority of this would be in the second half of 2021. We need doses right now and call on them to bring forward deliveries as soon as possible. COVAX partners are in discussion with Johnson & Johnson to receive doses in the second half of 2021. But this has not been finalized, and we do not know when they will arrive. Moderna has signed a deal for 500 million doses with COVAX, but the majority has been promised only for 2022. We need Moderna to bring hundreds of millions of this forward into 2021 due to the acute moment of this pandemic. Once the devastating outbreak in India recedes, we also need the Serum Institute of India to get back on track and catch up on its delivery commitments to COVAX. Furthermore, we need high-income countries that have contracted much of the immediate global supply of vaccines to share them now. I call on manufacturers to publicly commit to helping any country that wants to share their vaccines with COVAX to lift contractual barriers within days, not months. We also need manufacturers to give the right of first refusal to COVAX on any additional dose capacity. And we need the large vaccine manufacturers to enter into their deals with companies like Teva, Incepta, BioLize, and others who are willing to use their facilities to produce COVID-19 vaccines. Only by working through COVAX can we quickly get vaccines to those health workers that have been on the front lines of this pandemic for more than a year. We need to collectively set ambitious goals to at least vaccinate the world's adult population as quickly as possible. No one is safe until we are all safe. Due to lockdowns and people working from home, mobility decreased in the pandemic. This has led to fewer road crashes overall. However, because people often drive at higher speeds when there is less traffic, the number of deaths did not decrease due to the same degree. When speeds are lowered, the risk of death and injury reduces exponentially. This week marks UN Global Road Safety Week, and we are seeking to garner policy commitments at national and local levels to deliver 30 km/h speed limits in urban areas and generate local support for low-speed measures overall. Today, I'm pleased to be joined by Zoleka Mandela, who is the Global Ambassador for the Child Health Initiative, to outline the effort to ensure every child has a healthy journey to school. Zoleka, the floor is yours.
Thank you. Good afternoon. I'd like to thank Dr. Tedros and the WHO for hosting and including the important issue of road safety in today's briefing. As Dr. Tedros has said, this is an issue of high relevance for COVID-19. Throughout the pandemic as cities around the world have locked down, as the traffic dropped, we've seen a different reality where road traffic injury had been briefly lowered, where our air was made cleaner and our communities, in some ways, became more livable. Now, of course, we need our cities to be fully functioning again. But what our campaigning has been focused on is how we can take some of these temporary benefits and make them more permanent. Our call to action launched today is for low-speed streets in every community all around the world. I lost my daughter, Zenani Mandela, to road traffic injury. She was killed on a Johannesburg road and had just celebrated her 13th birthday. I have never recovered from this, and my family has never recovered from this. No family ever does. Today and every day, 3,000 children and young people are killed or injured on the world's roads. This is a crisis which is man-made and one that is entirely preventable. What we need is a big shift. We need 30-kilometer-per-hour streets where children, the old, and the vulnerable mix with traffic. We need this in every single community and in every neighborhood around the world. This week, we're pushing for 30-kilometer-an-hour commitments. Governments have been stepping forward. Spain has committed to 30 kilometers an hour in its cities. The whole of the Brussels city region has been going 30. And there's work for low-speed streets all around the world, from Bogota and Mexico City to Lusaka, Kigali, Ho Chi Minh City, and others. But we need more. This is a global agenda, and it is critical for climate and the Sustainable Development Goals. On my continent, the majority of children walk to school. The poor in particular have to get by on foot. Yet most roads in Africa, especially where vehicles are traveling at higher speeds, don't even have a safe footpath. What makes it worse is that we actually need more walking and cycling if we're going to fight climate change. But there's nowhere near enough investment in this, even when we've seen the benefits during COVID-19. So this is urgent, not only for the climate, but it's also urgent for our health, and actually urgent for our rights and the rights of our children. My grandparents knew quite a bit about fairness and human rights, and today I'm striving to keep their legacy alive. The poor and the vulnerable are forced to breathe toxic air and to have their children face speeding traffic every single day. Basic life-saving measures need to be put in place. Is it really too much to ask? So I call on all leaders at all levels to please join the call to action launched today. With partners around the world and at the Child Health Initiative, we will be taking this campaign forward in a new advocacy hub, which has 30-kilometer-per-hour streets as a key demand. As we respond to and recover from COVID-19, please make our streets more livable. Help people get to work and to school safely. Help them lead healthier, more productive lives. Our streets are for the people. Our streets are for our planet. Our streets are for life. Thank you.
Thank you, Zeleka. Thank you for sharing your reflections on the need for action to reduce traffic speed and improve road safety. Thank you so much for your leadership. Together, we're building momentum towards the launch of the global plan for the decade of action for road safety 2021-2030. We have made great progress, but with your support and partners around the world, we can do a lot more. Zoleka, thank you so much again. Over the weekend, United Nations Secretary General Antonio Guterres warned that the situation in the occupied Palestinian territory and Israel could potentially unleash an uncontainable security and humanitarian crisis. The health situation is also highly concerning, and in the recent escalation of conflict, dozens of incidents involving health workers and health facilities have occurred. Furthermore, COVID-19 testing and vaccination has been severely impacted. This creates health risks for the world as a whole. Protection of health workers and health facilities is an imperative in all circumstances. It's essential that the norms of international humanitarian law be fully respected. In particular, health workers and infrastructure should always be protected, and I call for leaders on all sides to ensure respect for these vital humanitarian laws. Christian, back to you.
Thank you very much, and thank you very much, Dr. Tedros. On the 6th UN Global Road Safety Week, the hashtags for social media are hashtag Streets for Life and hashtag Love30 if you want to join. Now with this, let me open the round of questions, and if you want to get into the queue of the already quite long list of interests, please push the raise your hand icon on your screen. We'll start with Jason Beaubien from NPR. Jason, please unmute yourself.
Yeah, I just wanted to ask about COVAX, how you would sort of assess where things are at the moment. Do you feel like it's successful? And do you think it's going to hit its target of getting 20% of people vaccinated in these countries that it's working in?
Thank you much, Jason, and I'll hand over to Dr. Bruce Aylward, please.
Thank you, Jason. When we set up the COVAX facility nearly a year ago now, the goal was to put in place a mechanism that could ensure that we could pool the risks associated with the development of vaccines, pool procurement so that we could send a strong signal to industry about how much vaccine would be needed in the world and procured to take away some of that risk, and also to be able to collaborate on the distribution of those vaccines. And so if we look today at where we are, the COVAX facility, as the Director General said in his opening comments, it definitely works. It's distributed already over 65 million doses, but more importantly, to over 120 countries. And nearly a quarter of those countries would not have been able to start vaccination if it had not been for the COVAX facility. That meant that they did not have donations from friendly countries, or they had not set up bilateral deals to be able to buy vaccine. So some of the most needy countries in the world were able to access doses because of the COVAX facility. So in terms of getting the country started, yes, the COVAX facility has been definitely a success. But that was not our ultimate goal. Our ultimate goal was, as you said, to get to 20% coverage this year, even higher if possible in all countries, and to roll vaccine out at the same time. And we're not there yet. Now, that's not because the COVAX facility doesn't work. It does. It's because, as the Director General laid out in his comments, that there are challenges with the financing of the COVAX facility to a certain degree, but even if you have money right now, you can't actually buy the doses. So the bigger challenge now is to be working with manufacturers to prioritize COVAX and COVAX contracts, to work with countries that actually have contracted doses to allow some of those doses to flow to COVAX with the support of manufacturers because of the contractual arrangements needed, and to do that very, very quickly. But there's absolutely no question that if that supply can be secured, can be freed up, COVAX facility is a great mechanism for getting doses very quickly, very rapidly, and very equitably in a fair manner out to all countries. Because now we're starting to vaccinate younger populations, non-risk populations in terms of severe disease in many countries that can afford to do so, while healthcare workers, older populations in much of the world do not have access to product. And our big concern right now, as was highlighted by the executive director of UNICEF overnight, is that that gap could get bigger if we are unable to get doses redirected into COVAX to be able to close that gap. So Are we on track to meet the 20% by the end of this year? Right now, that goal is at risk because we've had a gap of over 150 million doses already up to May, and that could get greater still going into June. That could be made up. Again, that was an important statement by UNICEF overnight, that there is enough supply in higher income countries that they could achieve their targets, still donate doses to COVAX, and we could catch up and make sure that 20% of doses get. So, we determine our future right now. There could be a self-fulfilling prophecy that we don't get to 20%, but with the strong commitment of countries and entities that control the contracted doses right now to redirect those, we could definitely see still 20% of populations, even more, vaccinated this year through COVAX.
Thank you very much, Dr. Elwood. We'll go to Simon Ateba from Today News Africa. Simon, please unmute yourself.
Thank you for taking my question. This is Simon Ateba with Today News Africa in Washington. The U.S. Secretary of State Antony Blinken lambasted the governments of Ethiopia and Eritrea at the weekend over what he described, his own word, as a continuing atrocity and denial of humanitarian access into the Tigray region in northern Ethiopia. The U.S. government is not ruling out sanctions, but without access to the region, what is the coronavirus situation in Ethiopia in general and in the Tigray region in particular? Are vaccines being administered there? Does the WHO have access? Thank you.
Thank you very much, Simon. I'll give to Dr. Mike Ryan, please.
Yeah, I'll speak specifically to the situation in Tigray, and my colleague Ria may be able to just look up the numbers on specifically on Ethiopia today. You're correct, Simon. Access is the key issue in Tigray. Access to victims in Tigray remains highly unpredictable, and this is due to the hostilities and it's a huge barrier to access to the populations that need our help. The continued reports of atrocities and attack are disrupting any attempt. The majority of health facilities are either destroyed or inaccessible to the population. We're seeing rising risks of cholera, measles and other outbreaks. We have also issues of continuing to get vaccines in. We have approved vaccine doses for northern Ethiopia for cholera vaccination. And we need to get those doses in there. We need to plan those campaigns to avert a cholera disaster. It's still a huge number of people. There's 4.5 million people in Tigray. 3.8 million of them are in need of health assistance. That's the overwhelming majority of the people in an area. We have 2 million internally displaced people, 63,000 refugees across the border into Sudan. We thank our operational partners on the ground. We have many. And we're certainly trying to carry out operations, and about 57 of the 93 were raided through our ad hoc mobile health and nutrition teams. But this is not enough. We need scale up and coordination and leadership, and we need access. And this is about access, and access, because unless we have access, safe access to populations who are protected and are not being attacked, we can deal with the current situation if we get that appropriate access and if hostilities can be reduced. But it is impossible to deliver sustainable humanitarian aid in the context of the ongoing conflict and the ongoing atrocities. And you've seen it all laid out in many different fora. Thank you. Maria.
I could just briefly comment on the COVID situation, but just to say that we're limited by the surveillance that is able to be conducted in challenging situations. So, as of the week of March 29th, there were around 14,000 cases being reported per week, and now we're seeing around 3.6 thousand cases reported to week, about 100 deaths per week. So this is something, our ability to detect trends, our ability to for countries to find cases and carry out public health actions associated with COVID is limited by the capacities to be able to do so. So we are supporting the country, as Mike has said, but through our regional office and country offices for COVID, as well as for other diseases that are circulating, other viruses that are circulating there as well.
Yeah, thank you. Yeah, thank you. I think parts of the issue are addressed. Thank you, Simon. That's a very important question. As we speak, the situation in Tigray, Ethiopia is, maybe if I use one word, horrific. Very horrific. 4.5 to almost 5 million people need humanitarian aid. 91% need food aid. And many people have started dying actually because of hunger. And severe and acute malnutrition is becoming rampant. And as Mike said, hundreds of thousands of people have been displaced or expelled from their places. And more than 60,000 fled to Sudan. Rape is rampant. I don't think if that scale was seen anywhere else in the world actually. Health services destroyed, looted, and majority of them are not functioning. And there is indiscriminate, unprovoked killing. And from this, what you would expect is majority of the people now residing in Tigray, Ethiopia, I don't think even they worry about COVID. So COVID is the list of their concerns. List actually, it's not even their concern, and there is no service, of course, but it's not even a concern now, because the chance of dying from all the issues, all the problems I have just outlined is really high. Compared to that, COVID is nothing. So I don't think for most of the part we're not even in a position to discuss about COVID, to be honest, because there are more pressing issues. So the solution is de-escalating, stopping the conflict, and trying to address issues through political means. I think peaceful means. There is always a way. When there is a will, there is a way. The same is true in any area where there is conflict. If leaders could commit to resolving things peacefully, can be done. But the conflict and all the things that I have said actually affect the health of the population seriously. And that's the situation. And I don't think COVID is, to be honest, an issue. I would like to put it that way. Thank you.
Thank you very much. Let me move on with Raymond from the Malaysia Business Insight. Raymond, please unmute yourself. And one question per journalist, please.
Yes. Hello, gentlemen, everyone. Thank you. It's Malaya Business Insight. Sorry to point that out. We ended the decade for road safety for 2011 to 2020, and we're moving into the new the new global action for road safety until 2030, kicking it off with this 30 kilometer per hour road safety campaign. And I think the action is very laudable. But I have a question on implementation, and that is how strong will be the policy actions that we will take in order for this to be truly successful, in the same light as the successes of the previous campaign for road safety, which included like road engineering, education, and things like that. Thank you.
Thank you very much, Raymond. And I'll maybe first ask Dr. Etienne Krug, Director for Social Determinants of Health, for this.
Yeah, thank you very much for the question. As you said, we're at the beginning of a new decade of action with a very clear objective of reducing deaths on the road by 50% by the end of 2030. And to do that, we do need strong measures. We know what needs to happen. It's a question of good laws and enforcement. It's a question of better quality of vehicles, infrastructure, better trauma care, and above all, political will at the highest level, because the response needs to be carried out in different sectors. The health sector has a role, but it's also about transport sector, it's about enforcement, so police, education, etc. And that needs to be coordinated from the highest level of government. So we do hope that these measures are going to be implemented, and we'll do everything we can at the WHO side to support governments in doing that, because these are the known measures. But in addition, we also want to see a modal shift, and with that we mean moving away from a car-based transportation system to one that's much more healthy, which includes walking, cycling, and public transport. This is better for our health in terms of preventing injuries and deaths, but also better for the environment, better for physical activity, which has an impact on non-communicable diseases. And to be able to walk and cycle safely in our cities, we need to reduce speed, which is a major risk factor. And that's why today, with the Global UN Road Safety Week, we are kicking off a big campaign on speed in general, but in particular on speed in our urban areas. And that's why we're calling for the Law of 30, the 30 kilometer per hour speed limit in urban centers, where cars, bicycles, and pedestrians mix. Thanks.
Thank you very much, and let me look at our special guest, Suleika Mandela, if she wanted to add something.
Hi, thank you so much. I think it's important to remember that particularly in regions like mine in Africa, that the majority of our children use their legs, they walk to school, and that it's the vulnerable and the poor who are constantly having to interact with very high speeds of traffic, especially being in developing countries. And I think it's so important to stress the importance of attending to the need of reducing speed, ensuring that wherever it is, just as Etienne was saying, wherever it is that the vulnerable users engage with the road, that there's a speed of no more than 30 kilometers per hour. Because as we know, more than 30 kilometers per hour is a death sentence. And I think these are very easy solutions. And I think our governments and our leaders really need to take into consideration that we continue to lose so many of our young people, so many of our young children. Every single day, 3,000 children and young people are killed or are severely injured. And I think it's important for us to remember that with speed, we'll continue to save lives. And I think it's important for our leaders to, most importantly, put into place life-saving measures that are going to ensure that we save more lives. And it's not just about our children, but it's for future generations to come, because it is a basic human right for our children and for our young people to, be able to thrive and to survive.
Thank you so much. #Love30. We'll continue with Imogen Folks from the BBC. Imogen, please unmute yourself.
Thanks, Christian. Can you hear me okay?
Very well. Go ahead.
Yeah, it's back to the COVAX and vaccine sharing that Dr. Tedros talked about at the beginning. I mean, how hopeful are you? What kind of conversations have you been having with countries where they're really talking now about starting to vaccinate the children, the under 16s, in the next weeks and months?
Possibly let me start with Dr. Bruce Aylward, and then others may want to chip in.
Hi, thank you for the question. We're actually very hopeful about the possibility of donations of or larger scale donations to the COVAX facility over the coming days, hopefully weeks at the longest, because we don't have months, quite frankly. We are in discussion with all of the major countries that have contracted substantial numbers of doses, and with all of them, we're looking at where they are in their vaccination today and when they may be able to start sharing in real time. I'd like to emphasize that in speaking to everyone, no one has surplus doses or excess doses of vaccines. Everyone says we're using the doses that we have that are released, that are authorized for use in our country. And what they're trying to do is look at how can we make sure that part of the doses that we do have can go to other areas where they're needed. So we're having, as you will have seen recently, France, New Zealand, Belgium recently, the UAE, if I remember correctly, and other countries. There's an increasing number of countries, Spain, Portugal, the U.S. even, have all expressed a desire to be able to donate doses. Some already have done so. Sweden, I meant to say as well. I'm sorry, I'm going to forget some now. So, that's a very different situation than we were a month ago. So that is progress. And what we're hoping now that these pledges of donations can rapidly change into actual shipments of vaccines to countries that need them. As we look forward to the Global Health Summit, hopefully there will be further commitments, donations in that regard, and then forward to the G7 after that. There are a number of major events coming up, or even before that, obviously. We'd like to emphasize as well, as the Director General said in his statement, that it's not simply the countries that hold the contracts that we need the help from. We also need the help from the manufacturers, suppliers, because they have contracts in place that would need to be adapted, and that can take a long time. We need them to be able to do that very, very rapidly so that any country, it would be fantastic if manufacturers were to say, any country that wants to donate vaccines to COVAX, we're going to make sure that you're able to do that as rapidly as possible within days, not weeks or months of signaling a desire to do so. So we think that we're moving the right direction. We're not moving there fast enough, and we're not moving there at large enough volumes. And at this point, enough of the world is vaccinated, the high-income countries, in terms of healthcare workers and the highly at-risk populations, that we feel they can be sharing, and most of them want to be able to. We are now working with them. Hopefully they can work out the modalities of that as rapidly as possible.
Thank you. And looking at Dr. Kate O'Brien, Director for Immunization, Vaccines and Biologicals.
Let me just add a couple of points to the ones that Bruce made. Authorization of vaccines for use in children, either adolescents or younger children, does open a pathway for safely protecting children who may have underlying conditions that put them at significant risk of COVID. But I think the important thing is that in the WHO SAGE population prioritization, moving to the immunization of people who are at very low risk of disease is much further down the prioritization list than immunizing those at highest risk of disease. And I think this is the big issue, is that we're at such a different place in some countries where pursuing immunizing people at very low risk for the purpose of trying to interrupt even further transmission, while at the same time there are countries who are still at the beginning of protecting those at the very highest risk of disease. And so I think, as Bruce has said, I think the big message here is it's time to share doses. It's really about timing of use of those doses. Not necessarily that any program should stop in any country, but just accelerating and using some of the doses that are available to share with countries who can get on with immunizing their most high-risk populations. And in due course, further protection of those who are at very low risk to pursue this goal of interrupting transmission.
Thank you very much. Next question goes to Jamie Keaton from the AP. Jamie, please unmute yourself.
Hi, thank you very much for taking my question, Christian. I'd like to go to some reporting that we had last week about the Congo. Last week, Dr. Tedros months ago said that you were outraged at sexual abuse allegations and that WHO would quickly and transparently find out the truth and punish those involved. 7 months later, why is it that the Associated Press has published more details about the sex abuse in Congo than WHO? What did you and Dr. Ryan know about these allegations, and when did you know about them? Thank you.
For the technicalities of how the independent commission works, let me hand over to Dr. Nedret Imroglu, who's the co-chair of the WHO Secretariat to the independent commission, and she can maybe explain a bit how the commission works, and that would tie into your question. Go ahead, Nedret.
Thank you. Thank you very much for the question. And I would like to start that we at WHO are all appalled with these reports. And as you know, when we have been informed, the first step was that to establish an independent commission who is going to investigate and do the fact-finding inquiries, as well as looking into the prevention of sexual exploitation and abuse in response to 10th Ebola outbreak in DRC. I want to underline that I don't want to talk on behalf of the Commission, but I would like to give you an update on the work they do. And they issued a press release on the 15th of May, on Saturday. The contact details of their communication officer is in the press briefing that media release that they have. And I request you to contact them in case you have further questions. But in a nutshell, this is the first time that the United Nations system is working with an independent commission on investigating and looking into the sexual exploitation and abuse. And I want to underline that they are independent of WHO, they are impartial, so they have their own secretariat. They have their own staff who is based in DRC, Goma, the coordinator since March. And they are working with an external supplier, an external independent firm that they have selected, who is extremely experienced in investigation of similar sorts of events and coming up with the recommendations as well. So the multidisciplinary team of experts of this external firm is in the field now in DRC. They started the investigation as of 1st of May, and the Commission, as you will see in the media release, is expecting to finalize its work and submit its final report to the Director General on end of August 2021. So all these cases are being transferred to them. They have information from various different investigations and reports, and WHO is going to take the actions in line with the recommendations of the Commission. But of course, meanwhile, we are doing everything to be able to accelerate and implement the current policies, strategies, procedures, and actions. And I'm not going to get into the details, but we'll give you a few highlights. One of them is that we are aligned fully with the UN system, so we are looking into a survivor-centered approach in all the reporting, investigation, deployments, staff training, all aspects of the work. And one of the stronger elements recently has been embedding a dedicated focal point for prevention of SEA in all WHO field operations, as well as strengthening the community engagement and putting a mechanism for reporting and investigation, which is also including DRC. And then a new policy emphasizes strongly the preventing and addressing the abusive conduct, and also raising awareness and training for everyone who works for WHO or with WHO. Maybe I could stop here. Thank you.
Thank you very much, Dr. Emiroglu. And that leaves us just a few minutes for one last question from Sophie Mokena from SABC. Sophie, please unmute yourself.
Thank you so much, Sophie Mokena from the South African Broadcasting Corporation. The Director General spoke about the challenges of a conflict in terms of derailing healthcare services. I just want to find out on the Middle East question, the Palestine and the Israel conflict, how has this conflict affected the operations of the WHO in that region, particularly during this pandemic? I mean, this man-made pandemic of conflict. And also I would want Zoleka to respond to that, because in our country, South Africa, his grandfather stood for justice, and he was at the forefront fighting for the liberation of the Palestinians.
Thank you very much, and we'll head for a short reply to Dr. Ryan, if possible.
No, I think Dr. Tedros has clearly highlighted this issue very specifically. WHO continues to work and has worked for years with all health actors in Israel and in Palestine, and has worked very well to be able to try and bring both sides together on matters of mutual interest. The health of people, the health of citizens, should be a central issue in everyone's concern. And I think the DG has clearly raised the issue that in the context of conflict, the health of civilians, their lives need to be protected, and the health care that's provided to them needs to be protected. And all attacks on healthcare need to cease immediately, and access to people for people to appropriate health services needs to be guaranteed. So I think we will continue to work with all those who wish to work to support people in need and people whose health, physical and mental health, is affected by this devastating conflict.
Thank you very much, Dr. Ryan. And yes, that ends our question and answer session for today. Thank you all very much, and sorry for those we couldn't get to anymore. We will be sending the audio file and Dr. Tedros' remarks right after the press conference, and the full transcript will again be available as of tomorrow. For any further questions, please send an email to mediainquiries@who.int. And don't forget the hashtags Streets for Life and hashtag Love30. And now for Dr. Tedros to close. Actually, we're closed. Thank you very much. Unless you have some closing remarks.
Yeah, sorry, Christian. Yeah, I was running to another meeting actually, so that's why I was thinking about moving from here to the Paris Peace Forum, which is starting actually in 5 minutes. So thank you so much to all for joining us today. And special thanks to Zoleka Mandela for joining us, and thank you for your advocacy, for your leadership, and also thank you to all colleagues from the media who have joined today, and to see you in our upcoming presser. I think still the Friday is not settled, because we will be starting a meeting of our governance, but hopefully we will see you on Friday. Thank you.
May I? Sorry, just to add, because I think it's important to say this. The staff of this organisation, I'm sure all the member states, truly appreciate the way in which the Director General has led us across all 194 countries in the face of so many emergencies, and particularly COVID. And we understand that, and you've seen today, I wondered if hearts could break anymore listening to Zuleika speaking about a lost child, or our chief speaking about the horrors of the situation in Tigray, Ethiopia. I think both ends of that spectrum truly show how people must go on, and we just thank our chief for continuing to provide leadership across the whole world at a time of such personal loss and tragedy.
Thank you for listening to Depictions Media Radio.
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Monday, May the 17th. We're honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations tomorrow, Tuesday. And Wednesday, you'll get written briefings with the relevant information with respect to the COVID-19 pandemic in BC at approximately 3 o'clock. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you and good afternoon. Today we're reporting on three periods. From Friday to Saturday we had 443 new cases of COVID-19 diagnosed in the province. Saturday to Sunday an additional 493 people were diagnosed with COVID-19, and in the last 24 hours an additional 424 new cases. Our total for the weekend is 1,316 people newly diagnosed with COVID-19, bringing the total number of people in British Columbia to 139,664. Of the new cases this weekend, 291 were people in the Vancouver Coastal Health Region, 861 were people who live in the Fraser Health Region, 36 people live in the Vancouver Island Health Region, 126 in the Interior Health Region, and 47 people live in the Northern Health Region. We currently have 5,021 active cases across the province, of whom 350 people are in hospital right now, 132 of whom are in critical care or ICU. And we have 132,841 people who have recovered from their acute illness with COVID-19. There are no new outbreaks to report in the province today, which leaves us with 3 active outbreaks in long-term care, assisted living or independent living, and 2 in acute care units. Sadly, this past weekend we've had additional deaths. 14 people in British Columbia have died from COVID-19, bringing the total number of people who have died from this virus to 1,648. Of the people who passed away this past weekend, 12 were people 60 or older, 4 each in the 60 to 69 year age group, 4 in the 70 to 79 year, and 4 were in the 80 to 89 year olds. In addition, we had 1 person in their 40s and 1 person in their 50s. And this reminds us that this virus, while differentially affecting the seniors and elders in our lives, also can have severe effects on young people, including people in their 40s and 50s and younger. And our condolences and our thoughts are with the family members, with the caregivers, the people who knew and loved all of those who died this past weekend. So far here in British Columbia, we've delivered 28,398 doses as of yesterday of all 3 COVID-19 vaccines. And this means over 55% of eligible adults 18 years and over have now received their first dose of vaccine in British Columbia. We've also given 130,023 second doses, which is about 3%, but we know that many people will be coming due in the next few weeks with their dose too. Everyone in BC now who is 18 years of age or older can register and book your appointment. It is now your turn, all of our turn, and I encourage everyone to get immunized as soon as you can. The data we shared last week reminds us that it takes as long as 3 weeks or longer to have the full protection from these vaccine doses. So the sooner you register and book your appointment and get your vaccine, the sooner you will have the protection that we are all looking for from this dose. Later on this week, I anticipate we'll be able to share more details about vaccine availability for youth, 12 to 17 as well. I do want to take a minute to talk about the second dose for people who in British Columbia who've received the AstraZeneca vaccine since we had our first shipment in about mid-March. We know that this vaccine, from the clinical trials and from the evidence that we've seen in other places, including the UK and here, that the protection that you get after dose 1 with this vaccine goes up over a period of as long as 12 weeks. And we know that even a delay for up to 12 weeks means that you get better protection from the vaccine, and that is the way that our immune system develops both our antibody protection and the cell-mediated protection over time. The remaining stock that we have of AstraZeneca here in BC, and we have kept somewhere in the vicinity of about 20,000 doses, is good until the end of June. So it does not expire. We know that there's been reports, and some of the lots that were received in Canada and some other provinces expires at the end of May. We have used up all of the AstraZeneca that we received that expired early on in May, and we now have vaccine ready and waiting for people for their dose 2, that we have some time before you're due for that, and we know that your immune system is well primed, and time because the vaccine is the expiry date is not until the end of June. So for all of those who have received their first dose, you will have the option of receiving your second dose of AstraZeneca. And I know that's very important for many people. They chose to receive AstraZeneca because of the way the vaccine is produced and the effectiveness that we've seen from this important vaccine in other places. But we will have more information as well in the next few weeks to give everybody all of the information they need to make an informed choice about what you wish to receive for your second dose if you received AstraZeneca. And I say in the next 2 weeks, by the first week of June, we expect to have all of the results in from the immunogenicity studies that were done in the UK and other places to understand if there is the same or better protection from receiving the AstraZeneca first and then a Pfizer vaccine second. So I ask people to be patient. We know that we have some time as your immune system is developing its protective response to your first dose. You will have the options of receiving the second dose of AstraZeneca, and we have stocks coming in to be able to support that. Or you can take the information once we have it and make your own decision about what you want for your second dose. So I just want to reassure people that we have not forgotten, and we will be providing the information as soon as we get it to help you make those decisions. I know as well that for many people this May long weekend is often the unofficial kickoff to summer. And I know that we are all looking forward to this summer being different. But we are not yet ready to make any changes to our current provincial health orders this week. This means this long weekend it is important for all of us to stay the course. That means staying local, staying small, and remembering to use all of our protective measures, even as more and more of us are immunized and we pass that critical period of time that our immune system is ramping up to protect us. As well, we now have 400 to 500 people a day that are still testing positive for COVID-19. And that reminds us that the virus continues to circulate. And we have to do all we can to stop those transmissions as we're all developing this protection. That's why we can't be making any changes right now. We can't be traveling, and we can't be having large gatherings this weekend. But after this, we will be able to move on and move ahead, and we will be reviewing the number of people vaccinated, the peak at 3-week effectiveness, as well as the level of community transmission over the next few days to determine where we can go from here. And there is a plan that we will be presenting to you. Until then, we all need to hold the line. What you do today determines where we will all be 2 to 3 weeks from now. And that's why everything that we're doing right now is going to make a difference for our summer. I don't think anybody wants to see a surge in cases in 2 weeks. That would just set us back again, and we don't need to do that. We need to keep moving forward. We know that now over 55% of people 18 and over in this province are immunized, and their protection levels are going up as more and more of us are getting started on that path. So we need to continue to hold the line right now and continue to support each other to get through these next few weeks, to be kind to each other, to be calm, and to stay safe. Thank you.
Thank you very much, Dr. Henry, and I wanted to start by passing on my condolences to the families, the friends, the caregivers of the 14 people who've passed away related to COVID-19 in the past 3 days. These losses are considerable, and 14 is a great deal. 1 is a lot, 14 is a lot as well. We know it's difficult. We're still we still see strong limitations in our ability to come together and grieve our losses, and that's why all of us have to provide in every way we can support to those who've lost loved ones in this pandemic. I wanted to note, and obviously Dr. Henry has said this, that there are 350 people in hospital related to COVID-19 today, 132 of those in critical care. And while those numbers are lower than they were at the height of hospitalizations in April, I think the height was 511 hospitalizations, they are still, if one wants to put it in context, significantly above what they were last April at the height of the first wave, for example, when 149 people were in hospital and 72 were in critical care. With respect to acute care beds, we have 713 base beds, vacant base beds across British Columbia, and 101 vacant base critical care beds. But more relevant and more important, currently 128 surge beds are in operation across health authorities, and 14 critical care surge beds are in operation, indicating the continuing stress on our healthcare system in spite of the significant drop-off of the number of cases in the last few weeks. So I want to acknowledge, as we do all the time, but all of our healthcare workers, whether they be in the community and long-term care and acute care, for all they're doing right now, and the need for all of us to support them, especially right now when we continue to see significant cases between 400 and 500 each day this weekend, and a very significant number of people in hospital, that we support our public health workers by doing what we need to do, which is following public health orders and following public health guidelines. As Dr. Henry said as well, we've had a significant level of immunization, and we continue to, so that about 55.8% of British Columbians have above the age of 18 have now been vaccinated. In the coming week, we expect to receive from the week of May 17th to 23rd 276,120 doses of Pfizer, 142,500 doses of Moderna.
Thank you for listening to Depictions Media Radio. Thank you for listening to Depictions Media Radio. thank you for listening today, and we want to know how here at Depictions Media, how we can help. How we can help get those stories out there that will inspire people, help spread the idea that we can put more love and more trust into our world. So click on our contact page, fill out the form to tell us how we can help. Please go to depictions.media for more information, and we will talk to everybody later on. Thank you for listening. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.